The body is always speaking. That is something I have come to believe deeply after years of sitting across from patients in my consulting room, listening to the stories they tell, not just with their words, but with the details they almost didn't mention, the tiredness they assumed was aging, the swelling they attributed to a long day on their feet, the small changes they noticed but filed away under the category of things that are probably nothing. In so many of those cases, the body had been speaking clearly and consistently for months, sometimes years. The language it was using just hadn't been translated yet. Well, I'm Dr. Naira Stein, Senior Health and Wellness Consultant, and if you are over 60 and you have been noticing things about your body that you aren't entirely sure how to interpret, things that feel too minor to call your doctor about, but too persistent to completely ignore, I want you to stay with me today. Because what I'm going to share with you are 7 signals that the kidneys send when they are under more strain than they can quietly manage. These are not rare or obscure signs. They are common, recognizable, and hiding in plain sight in the daily lives of millions of older adults who have simply never been given the vocabulary to understand them. We are here to change that. And we are here to help you understand your body with the kind of clarity and compassion that you deserve. Before we walk through the 7 signs, I want to spend a moment on something that I think is essential context, because without it, it can be difficult to understand why the kidneys send the particular signals they do, and why those signals so often go unrecognized for what they are. Your kidneys are, in a very literal sense, the body's most tireless workers. 2 organs, each roughly the size of a fist, sitting quietly beneath your lower ribs, one on each side of your spine, and between them filtering approximately 200 liters of blood every single day. Not every week, every day. They regulate the precise concentrations of sodium, potassium, calcium, and phosphate in your blood. They control blood pressure through a sophisticated hormonal system. They produce erythropoietin, the hormone that tells your bone marrow to manufacture red blood cells. They activate vitamin D into its usable form. They manage the acid-base balance that every cell in your body depends on. They do all of this continuously, without any conscious input from you, without rest, and almost entirely without complaint. That last point is what makes kidney disease so particularly consequential for older adults. The kidneys are remarkably stoic organs. They do not produce pain in the early and middle stages of dysfunction the way the heart produces chest pain or the stomach produces cramps. They do not send obvious, localized signals that a person can easily point to and say, "That is coming from my kidneys." Instead, they communicate through the body's broader systems, through the skin, through the sleep cycle, through the composition of the urine, through the legs and the face and the breath, through fatigue so pervasive it has become invisible precisely because it has been present for so long. And after 60, this complexity deepens. The kidneys age alongside every other organ. Filtering capacity declines gradually and often silently. Blood tests can appear within normal range even as meaningful function has already been lost, because the body compensates quietly and brilliantly for a long time before the numbers shift. This is why the signs we are about to discuss are so important to know. They often appear before the laboratory findings do. They are the kidneys communicating in the only language available to them, the language of the body. And learning to read that language may be one of the most valuable things you ever do for your long-term health. Let us begin with the first sign, and I want to describe it in a way that I hope will make it instantly recognizable to anyone who has experienced it without knowing what it meant. You wake up in the morning and your face looks different. Not dramatically, not alarmingly, just subtly puffier than you remember it being, particularly around the eyes. There is a softness, a slight swelling that is most obvious first thing in the morning, and that may ease somewhat as the day goes on. You may have attributed it to sleeping in an awkward position, or to allergies, or simply to the face that comes with age. But if this puffiness appears consistently, if it is there more mornings than not, if it seems to concentrate around the eyes in that gentle, cushion-like way, it carries a meaning that deserves serious attention. The medical name for this is periorbital edema, and it occurs for a reason that speaks directly to what is happening inside the kidney. When the filtering membranes of the kidney, the delicate, intricate structures within those tiny filtration units called glomeruli, become damaged or inflamed, they lose their ability to hold large molecules inside the bloodstream where they belong. The molecule most significantly affected is albumin, a protein that circulates in the blood and performs the critical function of pulling fluid toward itself through osmosis. Albumin is what keeps fluid inside blood vessels, rather than allowing it to seep into surrounding tissues. When albumin leaks through damaged kidney filters and is lost in the urine, blood albumin levels fall. The osmotic pulling force weakens. Fluid begins to escape from vessels into the soft tissues of the body. It follows gravity during the day, pooling in the legs and ankles. But overnight, when the body is horizontal, that fluid redistributes, and the loose, thin-skinned tissue around the eyes becomes one of the first places it appears. Morning facial puffiness that resolves partially through the day, combined with ankle swelling that worsens through the afternoon, is the kidney's way of telling you that its filters are struggling to hold the line. The second sign is one that unfolds in the bathroom, and I mention it because it is something people notice and then consciously decide not to think too hard about. The urine carries a layer of foam. Not a few small bubbles that vanish within seconds. Those are generally not significant. I mean a persistent, white, dense froth that clings to the surface of the water in the bowl after you have flushed, or that takes a meaningful amount of time to dissipate. The kind of foam that makes you pause, look twice, and then decide it was probably nothing. It is not nothing. That foam is almost always albumin, the same protein we just discussed, now appearing in the urine because it has passed through filtration membranes that were never supposed to let it through. Albumin behaves chemically in a way that resembles soap, and like soap, it creates bubbles when it meets water moving at speed. Persistent foamy urine is one of the most reliable early visual indicators of kidney filter damage available to the naked eye. It costs nothing to observe. It requires no equipment, and it is present, noticed, and silently dismissed by an enormous number of people every single day. If you have been seeing foam consistently in your urine over days or weeks, please do not dismiss it. That is your kidney asking you, in the clearest language it has, to pay attention. The third sign is something that happens at night, and many older adults have come to accept it as simply part of growing older, without ever questioning what might be driving it. I am talking about the need to urinate multiple times through the night, waking 2, 3, sometimes 4 or more times before morning, not because of a bladder condition, not because of prostate enlargement in men, and not because you drank too much in the evening, but because the kidneys are no longer able to concentrate urine effectively during the overnight hours. This deserves explanation because it is counterintuitive. Healthy kidneys overnight produce less urine but make it more concentrated. They do this with the help of a hormone called antidiuretic hormone, or ADH, which rises as you sleep and signals the kidneys to conserve water. The result is that a healthy person can sleep through several hours without needing to urinate, because the kidneys are efficiently managing fluid during that time. But when kidney function declines, this concentrating ability is often among the first capacities to be lost. The kidneys begin producing larger volumes of more dilute urine even at night. The body can no longer efficiently hold fluid through the sleeping hours, and so the bladder fills more quickly than it should. The result is nocturia, the medical term for waking to urinate more than once per night, and it is one of the earliest signs of kidney dysfunction that consistently precedes more obvious markers of disease. If you have been waking 2 or more times each night to urinate and have assumed it was simply a normal part of aging, I want you to consider asking your doctor to check your kidney function. It may be exactly what it appears to be: normal aging, or a bladder issue, or a prostate concern, but it may also be the kidneys speaking their earliest and most treatable signal. The fourth sign moves to the legs. You sit down at the end of the day and notice that your ankles have a softness to them they didn't have in the morning. Your shoes feel tighter in the afternoon than they did when you put them on. When you press a finger against your lower shin and hold it there for several seconds, a small indentation remains after you lift your finger away, a physical dent in your own flesh that takes time to spring back. This is pitting edema, and while it has many possible causes, persistent leg swelling in an older adult without an obvious explanation is a signal that deserves kidney evaluation. The mechanism connects directly to what we discussed with facial puffiness. Falling albumin levels allow fluid to escape from blood vessels into surrounding tissues, and gravity draws that fluid into the legs throughout the day. But there is an additional layer of complexity that I want you to understand, because it reveals something important about how kidney dysfunction creates a self-reinforcing cycle. As fluid moves out of the blood vessels and into the tissues, the blood volume inside those vessels actually decreases slightly. The kidneys interpret this as a sign of dehydration. In response, they do what they are designed to do when they detect low blood volume. They retain more salt and water, which pushes more fluid into already swollen tissues, which reduces circulating volume further. The kidneys, trying to help, inadvertently deepen the problem. Understanding this cycle helps explain why treating kidney-related edema requires addressing the kidneys themselves, not simply the swelling. The fifth sign is one that lives in the quality of daily energy, and it is perhaps the most insidious of the 7, because it arrives so gradually that most people cannot identify a moment when it began. They simply know that at some point, somewhere in the past several months or years, they became profoundly tired in a way that sleep does not seem to fix. Not the tiredness of a busy week or a poor night's rest, a deeper exhaustion, a heaviness that is present in the morning before the day has even begun, that makes the ordinary demands of daily life feel effortful in a way they never used to. Kidney-related fatigue has 2 primary drivers, and understanding them helps explain why it is so resistant to the usual remedies. The first is anemia. The kidneys produce a hormone called erythropoietin, which signals the bone marrow to produce red blood cells. When kidney function declines, erythropoietin production falls with it. Fewer red blood cells means less oxygen delivered to every tissue and every organ in the body, including the brain, the muscles, and the heart. The fatigue this produces is not the tiredness of inactivity. It is the exhaustion of a body running on less oxygen than it needs at a cellular level around the clock. The second driver is the accumulation of waste products in the blood, a condition called uremia, which develops when the kidneys can no longer filter efficiently enough to keep toxin levels within safe ranges. Uremic toxins affect brain function, alter the sleep cycle, and create a state of systemic inflammation that drains energy in ways that no amount of rest can compensate for. If you have been experiencing fatigue that seems disproportionate to your activity level, that doesn't improve meaningfully with sleep, and that has changed the way you move through your days, please consider asking your doctor to check not just your general blood panel, but your kidney function and your red blood cell count specifically. The sixth sign involves something most people notice but rarely associate with the kidneys: changes in the skin, persistent itching that has no visible cause, dryness that doesn't respond to moisturizer, a dull, slightly yellowish or grayish tone to the skin that seems to have settled in over time. These changes are collectively connected to the accumulation of uremic toxins in the blood and in the skin tissue itself, and to the phosphate imbalance that develops as kidney function declines and the body loses its ability to regulate this mineral efficiently. Uremic toxins deposited in the skin activate itch receptors at the nerve endings, creating an itch that has no rash, no allergic trigger, and no relief from antihistamines or topical creams, because the source is internal, not external. The phosphate imbalance compounds this by altering the composition of the oil glands in the skin, reducing their ability to maintain the skin's natural moisture barrier. And the subtle discoloration, that faint yellowing or graying, reflects the buildup of pigmented waste compounds that the kidneys are no longer clearing adequately from the bloodstream. When a patient describes persistent itching that is worst at night and skin that has changed in quality or color in ways they cannot explain, kidney function evaluation is always on my list. The seventh and final sign is one that lives in the breath and in the mouth, and it is deeply intimate and often deeply distressing for the people who experience it. A persistent metallic taste that alters the flavor of food and drink. Breath that carries an ammonia-like quality, faint but undeniable, noticed first by the person experiencing it, and sometimes, gently and uncomfortably, by those close to them. A loss of appetite that seems to have no emotional or digestive cause, but has simply arrived and stayed. All three of these experiences share a single origin. When waste products accumulate in the blood at levels the kidneys can no longer manage, urea, one of the primary nitrogenous waste products that healthy kidneys filter continuously, begins to reach the saliva. Bacteria in the mouth break urea down into ammonia and related compounds. These byproducts land on the taste receptors of the tongue with a metallic quality that transforms the experience of eating. They contribute to the breath odor that patients describe accurately as smelling faintly of urine or ammonia. And the brain, registering elevated toxin levels in the bloodstream through a specialized detection region called the chemoreceptor trigger zone, responds by suppressing appetite and triggering nausea, a protective mechanism originally designed to prevent further toxin ingestion that becomes deeply counterproductive when the toxins are coming from inside rather than from food. If you have noticed a metallic quality to your sense of taste, a change in your breath that brushing and rinsing do not resolve, or a diminishing interest in food that you cannot otherwise explain, please bring this to your doctor's attention. In the context of the other signs we have discussed today, these experiences form part of a pattern that deserves careful evaluation. I want to close with something that I hope stays with you longer than the specific details of what we have discussed. Each of the 7 signs we talked about today, the morning puffiness, the foamy urine, the nighttime bathroom trips, the swollen ankles, the relentless fatigue, the skin changes, and the altered taste and breath. These are not random or mysterious. They are coherent. They tell a story, and the story is the same in each case. A pair of organs that have been working faithfully without recognition, signaling in every way available to them that they need your attention. You do not have to wait for pain. You do not have to wait for a crisis. The signs are already there, and now you have the language to read them. The most powerful thing you can do today, not tomorrow, not after your next holiday, is to take this conversation to your doctor. Ask for your kidney function to be checked. Ask specifically about your GFR and your urine protein. These are simple, inexpensive tests that can reveal where your kidneys stand before the window for meaningful intervention has closed. Your body has been speaking to you. I hope today we have helped you begin to hear it.